or later touches pretty much all of us. How we care for our elders when they get sick. And we're going to look at it from an angle that really challenges us to think beyond just medicine, beyond the hospital, and to find what true healing is all about.
You know, this really says it all, doesn't it? An elder in the family, they're often this incredible source of warmth and wisdom. They're a blessing, a grounding presence in our lives. But what happens when that presence suddenly becomes fragile?
It's that moment we all dread, right? The phone call you never want to get, or just a sudden stillness in the house that feels wrong. One day, everything's fine, and the next, boom, your whole world has shifted. It can happen in an instant. A stroke, a really high fever, a bad fall, and just like that, the entire dynamic of the home changes. That sense of comfort they've always given us is suddenly replaced by this cloud of worry, and let's be real, a whole lot of panic.
Okay, so let's get into this, because what we do in those first moments is so telling. Our minds just start racing, right? And they fill up with all these anxious questions.
The practical stuff often hits you first. Money. The financial weight of it all can be a massive stress. And for a lot of us, it's literally the first thought that pops into our heads.
And then the fear spreads to the rest of the family. If there's a cough or a fever, you immediately start worrying. Is this contagious? What about the kids? And of course, our minds just love to jump to the worst case scenario. We start playing doctor, fearing the most serious things imaginable, like a stroke or a really bad infectious disease.
So here's the thing. When you lay all these worries out, you start to see a pattern. Our initial focus, a lot of the time, is on how the problem impacts us, our money, our family's health, our daily lives, and we find ourselves just desperately hoping for a quick fix to make it all go away. And that brings us to a really critical question. We think the solution is simple. Rush to the hospital, get a diagnosis, get a prescription, and job done. But is that really what healing is? Look at this comparison. It's so stark. On the left is what we usually do. Rush to the hospital, get the scan, get a couple of pills, and think, okay, we're done. But now look at the right. That's the real treatment. It doesn't end at the hospital. It starts the day they get sick. It's not about 2 pills. It's about long-term care that focuses on their quality of life. And it is definitely not a quick fix. It's a journey that could take months or even years. And that right there is the huge mental shift we need to make. The doctor's work, that initial treatment, that's not the finish line. It's the starting pistol. The real, challenging, important work of caregiving, that begins the moment they come back home. So what does this real work, this journey of healing actually look like? Well, it's about building a compassionate, holistic approach to their care. This whole path is really built on 4 pillars that go way beyond just a bottle of pills. Let's break these down, because this is where the magic of healing really happens. First up, consistent physiotherapy and a carefully managed diet. These are the physical building blocks. You know, without daily physiotherapy, a patient who's stuck in bed can have their joints literally seize up, locking them into place. It's so important. And nutrition? It's not just about comfort food. It's the fuel their body desperately needs to fight and recover. And third, and this is huge, we have to talk about active emotional support. I mean, imagine being an active, independent person and then suddenly you're confined to a bed. That can trigger a really deep depression. And that sadness, that feeling of being a burden, it can be just as deadly as the illness itself. They need to feel loved and wanted. All of that, combined with regular check-ins with a doctor, creates a complete circle of care. This sentiment is so powerful. It really gets to the heart of this commitment. It's about love. It's about remembering the care they gave us and returning it with that same tenderness and dignity, no matter how hard or personal the task is. And we have to be honest, the stakes are incredibly high. A patient who isn't cared for properly at home, who isn't moved around, whose lungs aren't kept clear, can easily get pneumonia. And the harsh reality is, if they end up back in the hospital in a neglected state, some doctors might decide not to pursue aggressive, life-saving treatments. Your care at home can literally be a life or death matter. Which brings us right to the core message of all of this. The most powerful medicine you can possibly give someone. You can't get it from a pharmacy. The best way to think about it is like this. The recipe for healing is a 50-50 split. Yes, the medical treatment, the pills, the science, it's absolutely crucial. That's half of the equation. But the other 50%, and you could argue it's even more important, is your affection, your attention, your dedicated care. And here's why that split is so important. Medicine works on the body's machinery, right? It helps the blood, it lowers the pressure, but it can't touch the human spirit. Your love, your presence, just being there for them, that's what gives a person the will to heal, the reason to fight. Someone who feels loved will always, always heal better than someone who feels alone.
In the end, this is what it's all about. We don't have control over how long someone lives. We can't magically add more days to their life, but we have incredible power to add life to their days. We can fill their time with dignity, with comfort, with love, making sure their quality of life is as rich as it can be, for as long as it can be.
So that leaves us with this final, really important question to think about. When we're caring for our elders, what's our real goal? Is it just about keeping them alive longer? Or is it about enriching the life they have? Thank you for joining me.